Today, you're going to talk about fat transfer of the breast. The fat transfer of the breast has been done in the United States really for the past maybe 7 to 10 years. It's becoming more of an accepted procedure. I think that it's a very good procedure because there's no implant being used when you're doing this for cosmetic purposes. The fat transfer of the breast is also being used with people with breast cancer reconstruction as a secondary procedure to augment the upper pole after implant reconstruction, or even deep tissue reconstruction where you have asymmetries and you're trying to even out asymmetries. The fat transfer can be used. Now, why is this such a good thing? One, for cosmetic reasons, I think it's a good thing because there is no implant that has a 10-year warranty. There's no implant to fail in 15 or 20 years. There's no implant you have to take out when you're older. There is no implant to get infected. Once this heals, it's your own tissue, and it is what it is. Now, the other thing that you have to think about is that there is a risk of cancer that's been associated with the breast implants, and that number is supposed to be 1 in 330,000 times augmentations are done, but it's a very low number, but it still is a number that exists. Here's an example of a fat transfer of the breast. The big deal on fat transfer of the breast is filling the upper pole. You can see this person's before, they had this upper pole, that area of cleavage is very hollow. This is what the fat transfer of the breast does very well. This little eye, see like an empty triangle, and you see it just fills in that area and gives a nice cleavage and a nice shape. So I put in the most fat, I put more fat into that upper pole area, but I also put in all the quadrants of the breast to increase the size of the breast. And you see you have a nice natural appearing augmentation. Now, the fat transfer is just like the fat transfer of the hips. Once the fat lives, it's a graft, and it's going to be there forever. This graft is not going to go away when you exercise. It's going to just act like a normal breast tissue. So this is a before, and this is an after of fat transfer of the breast. In my mind, I almost rather do a fat transfer of the breast than to do an augmentation with an implant, because I know that this fat is going to last for a lifetime, where the implant is warranted for 10 years. So here's a before and after with fat transfer of the breast, and you see we have a larger breast, but the main thing is that upper pole and the cleavage is so much better after the fat transfer than it was before. So I think that fat transfer of the breast is an alternative, and maybe in my mind a better alternative than a breast augmentation with an implant.